Okay, thanks for coming on board. Thanks for being on time. This is my regular update for TCM Health Betterment for November. Updates from Singapore. I'm Dr. Clement Ng. So thanks for joining this program. It's a short sharing updates on the coming season, and also known as the Health Betterment solar terms for the beginning of winter for those residing in the Northern Hemisphere. Allow me to introduce myself. I'm Dr. Clement Ng. I'm a TCM practitioner from Singapore. This is my online discussion and sharing. So I'm Doctor of Medicine in TCM from Nanjing University of Chinese Medicines. I have an MBA from Nanyang Business School. I have a computer engineering course degree from NTU. So currently I'm the chairman for the Technical Committee on Complementary Medicine and Health Product, responsible for the shipping of the Singapore standards, and the president of Singapore Acupuncture Associations, and I represent Singapore in ISO TC 249 as a head of delegations, and representing Singapore in the World Federation of Chinese Medical Society, as well as the World Federation of Acupuncture and Moxibuction. So allow me to introduce myself from the company point of view. This is a personal sharing, so I share my company, TCM. TCMU was established in 2003 as a website. The objective is basically to look into the following, just what you need to know about TCM to become a beautiful you, stronger you, calmer you, smarter you, and healthier you. So I'm approaching Chinese medicine from this perspective, from the needs basis, rather than the terms that in the many TCM world talk about heat cleansing, qi nourishing, blood nourishing. To me, to stay beautiful, to be stronger, to be calmer, to be smarter, and to be healthier is something that many of us are looking forward to. And this is something that I've established my company to be one, tapping the wisdom of Chinese medicines in developed products, training programs, as well as services in this particular area. And I believe in training as the basis of to allow a lot of people to understand the wisdom that have been passed down from generations. Because Chinese medicine has been around for a couple of thousands of years. And this couple of thousands of years, there are many, how should I say, misunderstanding about why this medicine system is still around. And the fact that it's still around, meaning that something behind it, something indeed is beneficial to all of us. So anyway, this is my quarterly sharing. So the agenda for today's program in a short 1 hour or less is to do the following, allow all of you to understand these particular symptoms. As we're entering a cooler and colder seasons, we notice a lot more people around us are experiencing upper respiratory system conditions. So is it a flu? Is it a COVID-19? Or is it a cold? This is something I'll be exploring. And I'll share with the background of TCM Health Betterment approaches in the coming month and what you can do for the coming months from the perspective of understanding the outcome, understanding the environmental issue, and using techniques such as acupressure massage that I'm training, I've been sharing, as well as medicated diet. Eat what you need to eat, drink what you need to drink. And I'll take the opportunity to share with you a course preview. I'll take this opportunity to share with you what are my current program and what I'm going to do from a TCM and U perspective. So is it a flu, a COVID-19, or a cold? So stay healthy as the weather becomes cooler. So you notice around us, there are more people having upper respiratory problem these days. So feeling sick can be especially concerning this day. Could you be sniffer caused by COVID-19 or the flu or a cold? I've been talking about it sharing online. Since the eruptions or the start of the pandemic COVID-19, 2019, 2020. Is a COVID-19 still something that we need to worry about? The answer is yes. So whether they go for vaccine updating is up to you. It's individual's choice. And I will share about how vaccine can be useful and for those who are weak. But nevertheless, your constitution and your internal immunity is still important besides having the vaccination done. So the question is, are you having a cold or cough or just having a flu? So determining the cause of an illness can be tricky because they share many symptoms like sniffling, coughing, and feeling tired. So, but they are important differences. So I basically extract one of the information that I discussed in one of my sub-health course to discuss about what exactly is a common cold. A common cold is an upper respiratory infection caused by a virus, and there are more than 100 different viruses can cause the common cold, and that make people sneeze and stifle, and is highly contagious. And though you can catch a cold at any time of the year, colds are more common during the cold and winter months. So, for example, we call it a cold. So, as we entering a cooler and colder month, for those that attended my medicated diet class, I share with you that in Singapore context, we do have seasonal change. And now that we are entering a cooler and colder month, this is because most cold-causing virus thrive in the low humidity. So we are entering a cooler weather with low humidity. So let me discuss and share with you what are the differences between influenza or flu and COVID-19. So influenza, the flu, and COVID-19, the flu, typically called influenza, and COVID-19, both are contagious respiratory illnesses. So affecting the lungs, breathing, and can be spread to others. And we are all veteran of the COVID pandemic, so we understand this. And they are virus-induced illnesses in nature, but the two illnesses are caused by different viruses. So viruses are different. Flu is caused by influenza virus, and COVID itself has a specific name, SARS-CoV-2. So COVID-19, by having this particular name, we name this virus, just like we name many of the other viruses that we talk about H1N1, H5N1, and stuff like that. But there are also variances as regards to this particular virus. And the vaccine basically act upon the known variants. And vaccine changes because of the type of viruses change. And we need to go for update is for that particular reasons. And when it comes to having a case where you're exposed to these viruses, what are the typical treatment approach from the modern medicine perspective? The answer is neither the flu nor the COVID-19 is treatable with antibiotic, which only work on bacterial infections. Virus is an organism that is a living organism. It has a cell-limiting time frame, meaning once you're exposed to a virus, you have to live with the virus till the virus die by itself. Question is, who dies first? So both are treated by addressing symptoms such as reducing fever. Severe cases may require hospitalization, and very ill patients may need a ventilator, a machine that helps them to breathe. So what happens is once you are exposed to the virus, you become the host of the virus and allow the virus to stay through this entire lifespan, typically 14 days. And they peak around 5 to 8 days in between here. So as a virus peak within the host, the whether the individuals can sustain or will live with the symptoms being presented will depend on the individual's internal body constitutions. If the body fails to react upon the influence by the virus, we need external help. That's where ventilator come into play. So while in the treatment-wise, we have antiviral medicines, this antiviral medicine is basically a medication that increase or the shorten the half-life of the virus, allowing the virus to die earlier, shorten the duration of both illnesses. So by doing so, reduce the impact to the host. So this is a treatment approach from the modern medicine perspective when it comes to addressing flu or addressing a case of COVID-19. How Chinese medicine approach COVID-19 is to change the environment of the host. By doing so, shorten the stay of the virus in the host. So when they're exposed to the flu or COVID, what are the differences? Let me compare regards to their slight differences. A cold, which are quite common, that's why I call it common cold. The flu and the COVID-19. So what are the difference? For symptoms such as we call it fever, it seldom happens in the cold. But in the flu case, it's really high, and COVID-19 is very common. There's one particular condition is where we talk about the running nose. Running nose, why? When it comes to cold, is quite common. In the flu case, seldom have we call running nose. Quite common in the case of COVID-19. And when the case of sneezing, when it's quite cold, it's quite usual. And when they having a flu, it sometimes rarely happen in COVID-19. In fact, the current COVID-19, the symptom itself is more toward upper respiratory. Cough is one of the key indicator. And from the difference between the 莲花清瘟 and the 清肺排毒 in addressing COVID-19, why I highlight the difference between the 莲花清瘟 and the COVID-19 the 清肺排毒 is because 莲花清瘟 was developed during the SARS period. SARS is also a called coronavirus, but the SARS attacked the human body from the Chinese medicine perspective from the heart systems, whereas the COVID-19 attacked the human body from the lung systems. And that's a quite distinct difference between the Chinese medicine perspective. So the TCM approaches to health betterment. This is what I will discuss here. When it comes to Chinese medicine, it has been around for a couple of thousand years. And there are many different health approaches that we adopt in addressing how we can improve a person's health in a way status or the level. So common methods in health betterments maintenance can be as following: time cycle approach. We'll look into the seasonal, which I'll discuss in the current sharing. We look into the mentally regulating approach, where this is something that a lot of people have no, in a way, not aware that Chinese medicine is very much into emotional management. How you are, or how a person eventually falls sick. It can be due to weather, it can be due to the environment, but more than 70% of the illnesses we observe in the clinical setting nowadays are emotionally related. So mentally regulating approach, mindfulness techniques, knowing how to breathe when to breathe is something that is very relevant. And I have this particular program currently pending approval by the authority. Hopefully it can be approved, and I share with all of you. And the dietary regime, minimum dietary wise, how to eat, when to eat, why must eat, is covered in my TCM medicated diet class, where I'm doing online as well as my courses with the People Association. And the Qigong approach, I'll be sharing with you a Qigong that I choreographed, adopting from the 8session brocade. And I'll run a course in the February timeframe. I'll let you know the details. I'll typically run it online and offline simultaneously. So body constitution approach is very much aligning with the medicated diet, because a man's meat is another man's poison. I strongly suggest that you do not embark on any particular diet until you know which constitution it belongs to. Because any diet out there being shared by individuals is only as good as a person who like it, as good as a person who benefited from it. And there are nobody on earth similar. So there's no reason for you to follow others, what they eat and how they eat. It may not be the same. And we have the scrapping approach, whereby the use of understanding of the meridian with the knowledge of acupressure massage. And these are the different approaches: scrapping, acupuncture treatment, followed by medications. So I want to highlight that in the sequence of event, in the sequence of approach to any illnesses, disease that you may be encountering or may be having right now, the use of medicine comes last. Meaning, if you are able to understand what happened before, knowing when to take care of yourself, taking care of yourself before weather changes, you'll be able to prevent illnesses from happening. Keeping a mind that is free from avarice, keeping a mind that is calm, will help you to maintain health. Because as I mentioned, 70% of illnesses are emotional in nature. Understanding what to eat, when to eat, regulating your breathing, okay, understanding your body constitution, adopting some technique to helping yourself or body to regulate through meridian massaging, you can avoid medicines. So my coming courses on fundamental class, these are in January. TCM Fundamental in Sexual Diagnosis, where I share with you the Chinese medicine history for the past 5,000 years. What are the theory behind yin and the yang, the five element theory, and why we make use of this theory to help us in understanding diagnosis, understanding illnesses. We look into the fundamental substances such as the qi, the accents, the blood, and the fluids in our body. So understanding all this help us to interpret condition that happening within us. And followed by the use of the medicated diet. So a class is starting next Monday night. If you are keen, you can always join me to learn how to eat to a healthy and beautiful you. And why skip 9 December? Because I'll be overseas. So if you are keen, I'll be sending out this to all of you. You don't need to scan at this moment. And if you can understand TCM pediatric care, Chinese medicine look into children's before birth and all the way up to 18, 20 years old until they hit puberty. We can only take care of our children half their life. It's a fact. So there's no need to us to worry too much about them in future because once you take care of them half their life, the rest of their life is up to them. So if we can prepare them for the world, and that's our job is done. So there's something that I look into TCM pediatric care application. You'll be learning how to understand the baby and child issue, the eczema, asthma, and the development disorder, and you understand how to apply what we call pediatric massage. Something you can build bonding since young. My 24 years old son, when I ask you what the massage, he still sit there and let me massage. So this is a bonding you can develop since young. And it also teaches women's health. This is why I have a specific course of women, because there's a saying in Chinese medicine, if you can take care of women's health, the man's health is given. For one reason is because women, we have looking into the case of menarche, period, pregnancy, postpartum regulation, as well as menopause. Women have multiple life. Men, one life. So this is something that unique about women. If you are keen, you can join me in my class. It'll be in the month of December after I come back from Perth. And some basic principle for health betterment to prevent before disease strike. Prevention. This is the key thing that we need to look into. Understanding that every one of us will die one day. We will expire in about 32,000 days. So some of us already passed 16,000 days. So this is a fact. So we all go through a life cycle. We start by taking a stroller, we may end up taking a wheelchair. So the question is, how can we prevent and make sure our quality of life still remain? So prevention is something that we look into, and prevention is something that against the evidence base from the modern medicine perspective. If you are keen, you can go to my YouTube. I discuss about the importance of evidence base and the respect evidence base. But when things become evidence, it's too late. So we should prevent before disease strike. And to set before pathological change, interception. This is something that I promise, and I always encourage all my participants, please, if you are Singaporean, sign up to Healthier SG. Because Healthier SG is the best we can do now from the modern medicine perspective to intercept before pathological changes. If you can do the prevention, very much better. But if not, when some signs showing, take precautionary measure. If you can intercept at this moment, treatment will be simple and treatment will be cheaper and your quality of life will definitely be better. And in the case of you encounter with a disease, the question is to nourish after the recovery from the disease, the relapse prevention. This is very important. I share a simple formula known as A plus B equal to C. If the condition that trigger your current event, for example, there are 10 possible risk factors that trigger stroke. And this 10 possible risk factor address amount to 90% of possible risk for causing a stroke. If you have all these risk factors, eventually you have a stroke. After a stroke, does the risk factor go away? Answer is no. You just have a weaker body because of the stroke, plus the risk factor that triggered the stroke. So the question is, should you be more careful to prevent a possible relapse? Like for example, you have a COVID. I believe we come across individuals out there have more than one or two or three COVID. You have the first COVID attack. Why? Because you are weaker than others. But if you don't take precautionary measure to make yourself healthier, will the second time come around? Answer is yes. So the important to nourish after the recover from disease. And this nourishing approach is something very much lacking in the modern medicine, and that's a fact. So you are encouraged to look into something to understand the body constitution, to look into possibility of strengthening and nourishing yourself to become a better you tomorrow. And we're now looking into the how we can take care of health according to season, timing, locality, and individuals. So in this sharing, I'll be talking about seasoning and timing. The approaches to health betterment, looking from the season, timing, health betterment approach. So time, seasonal, health management approach. What are we looking at? We are looking into this particular sharing from Huangdi in the Classic of Medicine, Huangdi Nei Jing, that man comes to life through qi of heaven and earth. He grows, develops in accordance with the laws of the four seasons. These are the four seasons. While we are staying in 1 degree north, our general weather patterns feel very much similar to what happened in the north. And I share this particular video on what we call solar terms. Some of you have seen it before. I take it as a refresher as part of the continuation of my course. A solar terms. A solar term is already been endorsed by UNESCO as an intangible cultural heritage of humanity. So the 24 solar term knowledge in China of time and practices developed through observation of the sun annual motion. It has been inscribed in 2016 on the representativities of the intangible cultural heritage of humanity. So let's take a very short video. Let me play the sound for you first.
Given the title of the fifth great invention of China.
So this solar term table, as outlined here, we are currently under this particular era time known as commencement of winter, and we just passed 22nd of November, the minor snow. We are going to major snow soon. So the weather, and like what I shared when I started in the 7th of August, my previous sharing, from 7th of August, we welcome a solar term commencement of autumn in Northern Hemisphere. The weather season will be in a way due to the La Nina phenomenon, resulting in extreme hot weather along with dry southwest monsoon. So I have shared this in the 7th of August. And this is an example I share. For example, in the photo I took in the Singapore River Reservoir, September 15, the water level was noticeably lower. And now, with the arrival of winter, 7 November, we are experiencing a drop in temperature, increased rainfall, occasional outbursts of coldness. So what happened now? The lingering heat of the past few months will continue until mid-October. We passed the time. My sharing is supposed to be on the 7th of November, but I was overseas. Yeah? So now we are currently in this particular area. November to October, October to November. From October to November, there's a sharp drop in temperatures. So according to the season, November 7 marked the start of the solar term beginning of winter. And those residing in the Northern Hemisphere, wave of chill coldness are in the air as they've been raining more frequently and heavily recently, as we predicted and is supposed to be expected. So in the next few months, the temperature will continue to dip. So on the day of the beginning of winter, I'm not sure whether you have done this part, nourishment of winter. And some of my participants have attending my class. I have shared with them about this particular aspect. So preparing a warm, nourishing, medicated diet for the whole family to strengthen the body and prevent illnesses may come along due to the cooler weather. So your body will be strengthening throughout the year. So this season, from November start all the way to end December, you are advised to eat nourishing stuff. And we have passed the 22nd November, minor snow. So the temperature will continue to drop due to influence of northeast monsoon. It will become strong wind. So you encounter it right now. So most part of the northern hemisphere snowfall will start to occur. Way back in when my sister is residing, my eldest is in Calgary. 2 days ago, she just sent me a photograph of the heavy snow she's encountering in her backyard. So the overall climate will become cooler and relatively dry. So light snow, 22nd of November. So now we are under light snow. So the continual cooling weather will continue. And as we go on, by the time 22nd of December, this is a winter solstice. Most people at this point, what happened? They'll basically take what we call rice dumpling. But as a student of mine, I appreciate that you have not be more profound than many of them, because this particular day on 22nd of December correspond to the shortest daylight and the longest night. So when the sun is furthest away from the earth for those living in the northern hemisphere. So winter solstice is a time where you have the longest night, shortest day. So from this moment onward, actually the temperature is start to rise. But nevertheless, this is a time where you are encouraged to eat more warm stuff. Because from the TCM perspective, health betterment perspective, during this cold solar term, mark the tipping point period where the yang qi and the environment will gradually rise. So I mentioned, after the 22nd of December is the rising time. So the best time to start replenish excess of yang element is at this time. So similar to beginning of winter, if proper nourishment was done during the winter solstice, then the benefit will last for all year round. So this is a period I want to highlight here. While a lot of people mention that in Singapore or in those near the equator area, we don't have a distinct weather changes. We don't have 4 seasons, but technically there is. For example, now we are at this period. The weather are cooler. So symptom of our bodies respond significantly to the changes in the weather. And these responses is very important because if you are aware of this, there are few conditions that we have to be very mindful about. Because as the weather turns cold, there are something changes within our body. And it's very important for us to prevent this from happening. And I highlight a few particular conditions. Once we are entering a solar term beginning of winter, the weather will turn cooler gradually. So from a TCM perspective, the coldness will affect the yang element of the body, especially the kidney, vice yang. So if you are those diagnosed or those who are went through the medicated diet, you understand your body constitution. If you are yang deficiency like myself, I'm yang deficiency by the way, your body will start to feel much colder. So I observe more patients feedback that their legs are getting heavier. Their rheumatic painful condition around the knee, lower leg are happening more frequent. And some of those yang deficiency individuals, you'll start to experiencing loose stool, frequent defecation, bowel movement because of yang deficiency. And that's I'm going through right now. So that's the general health betterment approach to focus in the protection of yang elements of the body, keeping warm and nourishing the excess of the kidney, visceral systems. So how to do about doing that? So as the weather turns cooler, one of the best way to keep our body warm is having adequate sleep. I sleep earlier nowadays. Sleeping wise can raise the body yang energy, help to keep the body warm. Sufficiency of sleep also help to enhance immunity and support healthy cognitive development in the prevention of dementia. There was an article published previously on our national newspaper 6 times. Those who are experiencing insomnia in their 50s, there are high probability they will be developing into dementia as time goes by because they don't have adequate sleep. So in my course, sub-health management class, I'll be touching on symptoms such as insomnia, gut acid reflux, vertigo, hyperhidrosis, and polyuria conditions. So if you are keen, you can join my class. And I also talk about stroke and stroke sequence management in January. where these courses are basically touched on every day in Singapore, there are 26 new cases of stroke, meaning every hour you are looking at one stroke patients. And as weather turn cooler, these are something that it become more and more frequent. And I'm also sharing this. All these courses will be shared with all of you and sent to all of you. So don't worry, you have all the code to sign on. And this acupressure massage class will be in February. And what are the common illnesses that we can observe in this current season as the weather turn colder? So as the temperature become cooler, the blood vessel in our body will become constricted and the blood become thicker, which may impede the blood circulation and increases blood pressure. We are part of the elements. External temperature drop, the internal body will react. And cooler weather corresponds to seasons of higher incidence of cardiovascular diseases such as stroke and heart attack. So these are one of the high seasons for stroke. And the key to prevention is to stay warm. So if you are those who are experiencing all the underlying conditions, such as high cholesterol, hypertension, diabetic, you need to be especially aware of any anomaly they may occur in your body or their body. Because the cooler weather may also induce common colds, as I highlight in the beginning of the sharing, because of the humidity, cough, and those suffer from chronic asthma must also become more aware of their conditions as cooler weather correspond to higher occurrence of attack. Many a time, a lot of people not aware that why a person cough, cold is a major factor. And a person cough is very much a self-defense. Because when I from a warm environment go to a cold environment, the cold air coming into my body, I'll cough. Why? Protect myself. So coldness is one of the typical, in a way, triggering factors for cough or even asthma. Something to take note. And so I have developed a series of programs in health betterment through Chinese medicine to equip you with knowledge and skill to take care of yourself and your loved one. And health betterment approach should be something simple and easy to follow so you can continue to do it to harness the optimal benefit of health. And that's why the reason why when all my discussions, I talk about some series of programs such as the use of the fundamental, anyway, I'll skip this part. So health betterment approaches for the season, besides ensuring adequate sleep, simple acupressure massage technique and medicated diet will help. So let me share by acupressure massage. Why I always highlight acupressure massage? Acupressure massage basically using your hand or a simple tool known as a scraper. This hand and your so-called your scraper is to allow you to improve your circulation within your body. While you're sitting there listening to me, your internal body is very busy. Your heart is pumping, the food that you took for your dinner is going through your digestive system. If you are able to use external force to make your internal energy flow better, that's something that you can help yourself immediately. So the use of acupressure massage is something that I encourage everybody to learn. And acupressure massage point for the season are as follow. The 4 acupoint, Guan Yuan, CV4, Yang Ci, SJ4, Yongquan, KI1, and Shen Shu, BL23. So these are the 4 acupoints. The corresponding alphabet here basically indicate their corresponding meridian or vessel, we call it. So the point on Guan Yuan, CV4. The warming switch on the lower abdomen is the Guan Yuan. This acupoint is basically the command point for small intestine viscera. This small intestine responsible for our internal absorption of nutrients, just a modern medicine understanding. And this acupoint is a command point for absorptions. So when someone experiencing weakness or coldness around here, he or she may have problem absorbing nutrients. So Guan Yuan, this acupoint, located 4 finger 3 chun below the umbilical. So for those experiencing coldness at the bottom of the feet, this area need to be kept warm. And every night before going to bed, warm your hand by rubbing and place it around this particular area. I typically place a warmer at this point. Let me bring out the warmer to show you. Just I managed to find this warmer. This is a hand warmer. If I were to on it, you'll notice there's a 40 degrees indicator on the warmer. So it can be continued to stay at 40 degrees, and I'll typically place it around here when I go to bed to keep myself warm. And this device is very good for those experiencing dysmenorrhea. We call it menses cramp. Very obvious. So this is called 翻元. The next acute point known as Yang Ci, SJ4, number 4 point on the Sanjiao meridian, is a warming switch on the hand. This acute point is where the yang qi accumulate and is located at the midpoint of the back of the wrist. So let's take a look. This is the hand right at the midpoint. So you put your right at the midpoint here. This is called yang ci. And we can push toward the body. Let me share with you. This is point yang ci. So to stimulate yang ci point, press it gently over a period of time. It can help to alleviate symptom of coldness of the hand. You push it to the body. You massage it, and you push it toward the body. You warm out the body. And those who what happen, usually afraid of cold, can often press this acute point. This point is called yang ci, the warm pool. Okay, yang ci. And the next acute point, Yongquan. This acute point is a warming switch on the foot. Located at the bottom of the foot, in the depression of the front of the foot, it is the first acute point of the kidney meridian. So take a look at your base of the foot. It's basically located at the middle of the foot, in the intersection between the upper 1/3 and the lower 2/3. This is an acute point. Yongquan is the first point of the kidney meridian. It's especially suitable for elderly women who are afraid of cold and those who are suffering from kidney deficiency, lack of strength, and lack of energy. The same warmer that I'm using, you can also actually place it at the moment. And for those who are afraid of cold, a daily consistent massage on the Yongquan acute point can increase the body energy, strengthen the body, and prevent disease. I have a video on foot reflexology in my TCM and YouTube. That particular massaging technique is covered in my acupressure massage class under People Association as well as under Fei Yue. So if you can that video is open for all. You can take a look at the video. In my email update that I sent to all of you after this class, I will include the link to the particular massage, foot reflexology massage technique, so you can learn how to massage this acute point. You are encouraged to massage from this particular angle. Let me share with you. Going toward this direction, pushing it down this way. Okay, this is called Yongquan. Okay. The next acute point is called Shen Shu, the kidney shu. A shu point indicate a point on the bladder meridian. So this acute point is a warming switch on the back of the body, and located 2 fingers lateral to the lower border of the spinal process of the second lumbar vertebra. It sounds complicated to find the second lumbar vertebra, but it's very simple. The point right here is basically behind your umbilical. So you find your navel or umbilical, belly button, you trace all the way back to your back. That area corresponds to L2. And you just do a rubbing action up and down, warming, keeping it warm. This is important. Once the kidney yang, as we highlight in the class, is one of the key elements that we need to strengthen. This area keep warm, the whole body will be warm as well. So Shen Shu BL23, massaging Shen Shu help to warm and nourishing kidney yang. Good for those with kidney deficiency, lumbago, energy loss, has healthcare treatment effect. So this point help. So rub your hand hot with the palm and rubbing Shen Shu back and forth. about 50, 60 times. Number-wise, it's up to you. So important to keep it warm. So for example, now let's take this demo or practice itself. You warm the hands. 10. Then you rub your hand back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 times. That's all you need to do. You feel better. And the use of medicated diet. Why medicated diet? And what is a medicated diet? A medicated diet is basically something that you eat every day. You cook a dish at home. You add in something that you need. And that's all you need to do. So for the current season, coming season, I share 3 medicated diet that may be useful for you. Or when I share all this diet, take it as a reference. The objective is learn the principle behind the design of the recipe rather than stick to the recipe by itself. So this 3 medicated diet, the black sesame substantial porridge, qi nourishing and calming black chicken soup, wolfberry sea cucumber quail egg soup. If you happen to be a vegetarian, just remove all the corresponding meat in the sharing. So for example, a black sesame substantial porridge. Black sesame, we are quite common understanding. A substantial is known as a desert plant roots, also known as desert ginseng. It's a desert plant roots, desert ginseng. And this particular substantial is warm in nature. It helps to strengthen the kidney systems. So this particular formula itself can help to warm, nourishing the liver and the kidney system, nourishing the 5 visceral system. Once the kidney is strengthened, all organ visceral system in the body will be taken care of. And this is an artist's impression of how it looks like. And as for the black sesame, qi nourishing and calming black chicken soups. The ingredients inside include the following. We have a qi nourishing and calming formula. This formula is available on my website if you are keen. I have astragalus, angelica, woodberry, lilybug, yam, and peoria. And so-called black chicken. Some ginger to taste. This is how it looks like in terms of the formula 3. And when you prepare this particular dish, you can basically throw all the dish together, put it in a tea bag, and you boil them. Efficacy-wise, nourishing the qi, regulating the liver system, and the eye, calming, and good for beauty maintenance. Why good for beauty maintenance? There's a principle behind beauty management is strengthening the internal qi and the blood. The external look will be nice. For vegetarian, you can replace the black chicken with black bean, or you can consider American ginseng. So how it look like, artist impression, this is how it goes. Qi nourishing and calming black chicken soup. And the wolfberry sea cucumber quail eggs. When you talk about quail is known as the ginseng of the bird family. And quail eggs are known to be qi nourishing. Don't worry about cholesterol. Cholesterol itself, more than 80% of the cholesterol is internally synthesized by our liver system. What we consume is less than 20% of the cholesterol. And you need the protein. Sometimes, animal protein is good for the body, but quail egg is quite nourishing. Only sea cucumber strengthening and nourishing the kidney systems. It's warming. Woodberry, good for the liver, good for the lung, good for the kidney system. So a combination of this simple formula, you can tonify the kidney, the lung visceral system, nourishing the mind, prevent dementia. Why prevent dementia? From a Chinese medicine perspective, the cognitive ability of an individual is governed by the heart system, the brain marrow governed by the kidney visceral system. So from a Chinese medicine perspective, any recipe or any approach in strengthening kidney and the heart system will help in the prevention of dementia. After all, the other system indicating that there is no cure and no potential treatments, we can always address and see whether another system can help along the way. So this particular formula here can strengthen the liver and good for the eye. So the ingredient is as such. So that completes a simple sharing what we have talked about. And what I'll highlight with all of you is mastering the knowledge and skill in health betterment is the best gift you can give yourself, your family, and your friends. I always like to say this statement here. When we are healthy, if you are parents, your children will be happy. If you are children, your parents will be happy. So staying healthy is something that you can take care of, you can give to yourself and your loved one. And I strongly like to have all this sharing. We hope to have more friends to come and learn better than health betterment. And to me, it's something that in my past many years, I like to talk about health betterment rather than well betterment. For some reason, it's personal to myself. But nevertheless, I developed a series of programs in currently still approved under SkillsFuture. We will see how it goes. But to me, without health, all other skills is irrelevant. So I have a current SkillsFuture credit approved courses to give you a short course review. My essential TCM skill for health and wellness practitioners. While this title is for health and wellness practitioners, it's for all who keen to understand how the health and wellness industry can develop. Because as we are approaching super aging, health and wellness industry is a sunrise industry. And these are my programs since 2022, the fundamental essential diagnosis. This is important. A lot of people like to immediately delve into the health in terms of insomnia, if I have problem, how to solve. Then we talk about qi nourishing, blood nourishing, fluid nourishing. Then you are confused. What exactly is qi? What exactly is blood? What exactly is fluids? Your understanding of the English characters, English words, may not exactly the same as the meaning behind those words because we translated from one language to another language. It takes some definition to be appreciate what exactly is covering. So I encourage all to attend the fundamental essential diagnosis. If you are keen to understand how the meridian works, Chinese medicine look into the human body from the systemic perspective. We have multiple organ visceral system. We call it the zang, we call it the fu. And this organ visceral system within this piece of skin, they are basically made of multiple subsystems. And these subsystems are linked together via the meridian collateral pathway. In the traditional form, we have 365 acupoints covering 20 meridians. And these are like pathway linking everybody together, linking all the organ visceral system together. And through the use of the proper massaging technique, you can help to mobilize the energy within the system by itself and help to ensure adequate or good health betterment approach can be achieved. If you know how to eat, when to eat, what to eat, how to prepare, eat according to the season, eat according to the weather, you will attain better health. And that's how the entire design approach of my series. Then look at the TCM pediatric care. Why? Because health betterment should start as young as possible. It's a fact that I have developed all this series of programs. But many of my participants only come to the class when they are already not healthy. So what I highlight here is we can help our young one taking care of their health before complication kick in. That's something that we can look into. And subsequently followed by women's health program. Because women, as I mentioned, is something that to me is the first doctor of the family. Mother is the first doctor of the family. If you take care of the women's health, you take care of the entire family. And the pain management is when things happen in our body, the first reaction we come across is pain. But exactly how painful you are, nobody knows. And how we can address pain, and from the Chinese medicine perspective, I'll discuss in this particular program. And the stroke and subsequent management is because every one of us here will know somebody who have a stroke. So you can learn something from here, benefiting yourself, benefiting a loved one, will be good. And suffer management is, of course, I have prepared. And I believe some of you already attended, but nevertheless, it's part of my sharing, I'll discuss. So these are my program. And I also have program under what we call PA. I will be partnering PA since 2006. So my PA courses are available through this particular link. I have more than 5,000 participants now in Singapore. Some of you are one of them. I thank you. And I'm in the process of working with some to run the alumni program. So I'm not sure how to go about embarking the journey. So if anybody have certain idea how to run the alumni program, let me know. So these are the latest courses I'm available. Currently, my courses in Papaya East, Pasir Ris East, Boon Lay is ongoing. And I have Udemy program, whereby I have currently on Udemy certified blended coach. I can conduct online training and classroom training on Udemy since 2015. So currently I have more than 149 country students. And this is my August discount code. Anyway, I'll change it later. So I have more than 6,000, now more than that. Now it's about 6,500. More than that, more than that. Okay, I have close to coming to 8,000 participants from 149 countries. So I believe I'm one of the still lecturer trainer with the most number of country students right now. So anyway, you will be giving this discount code later. So these are my program, and I encourage all of you to come on board and have a class on what you call 八段锦. This is my discussion where I touch on the CM 八段锦, designed by myself, incorporating traditional 八段锦 Qigong, meridian knowledge and system knowledge, dynamic breath, a mindfulness technique, vitality, self, your heart, and the spirit. So all of you, thank you for coming on board. And it's a short discussions, and I look forward to see you in the class. And for those who have seen you, thanks for joining this discussion. As I mentioned, I'll speak whether, irregardless of how many participants, I do a recording. Thank you. Well, thank you, Evelyn. Thanks for coming on board. Okay, nice for sharing. If you are still here, thank you very much. So, any questions? Yep, I'm on time for my sharing discussions. The next sharing will be at 8:30 where I speak in Chinese. If not, thank you very much. I will send the video update the PowerPoint to all of you, and as well as those coming classes, you can send to anybody who will feel that will benefit from this particular sharing. And just take note, the weather is turning cooler, and the coldest time should be around mid of January. So if you are those who are with all the underlying illnesses, please keep warm, because when it happen very fast. Okay, thank you. I will see you around.